Let's break down the different types of treatment. We have so many as part of SCAT. And I know you talk about this a lot when we're lecturing at different conferences and presentations. So
Yeah.
there you go. You're on stage. Go ahead, Dr. Jenna.
No, I mean, I think CBT is a really big aspect of our treatment. So the cognitive behavioral therapy, and I think one of the reasons for that is we talk a lot about their thoughts, right? Those feelings that are kind of intertwining with those thoughts and how they really act, right? And so for them, a lot of times they're shutting down. Some of our kids, though, interestingly enough, are actually externalizers as well. And we kind of explain that the more, less timid you are, the more underlying whys there might be. So, they don't always have the same presentation, but for the most part, you know, that kind of shutdown mode is more of kind of that behavior that happens. And so in our treatment, we talk a lot about like, let's talk about what's going on for you, right? So sometimes parents will give us a call and they'll say, like, are you going to talk about selective mutism with my child? My child doesn't know about this. I want to go about this whole treatment without telling them anything. And we'll say, obviously depending on the age of the child, if we have a 4-year-old coming in, no, we're not necessarily going to grab the DSM and, read the definition of selective mutism to them. But we do talk about the scaries of how it sometimes is hard for us to get our words out, or we do talk about, where they are on the social communication bridge. So for every child, that CBT aspect is us drawing out a social communication bridge for them, talking about those thoughts, right? Showing them where they are more non-verbally, where they're maybe pointing, handing things, giving a head nod, a gesture, right? Writing something and showing it or drawing it, whatever it might be, texting someone, emailing a professor instead of telling them. Stage 2 is kind of that transitional strategy, right? Where they're more maybe telling parent or telling a verbal intermediary, like a teacher, a peer, a cousin, they tell someone else, or maybe they're starting to make sounds. And that's a way of progression into words. And then also stage 3, which is where they're comfortable using their words, right? And that, like Dr. E said, can range from like 1 to 2 words to fully elaborating, could range from whispering to talking very audibly. So there's so many different extensions of the bridge, but we will draw out the bridge with our kids and teens, and we'll talk about that with them because that is really important. And so that is that CBT aspect where we'll really start to uncover really those underlying thoughts that are going on. Why is it really challenging for us at times? And what are those feelings? And so we have a feelings chart that we use a lot too, where we break down our feelings for a younger child, 3 to 0, older child, 5 to 0. And really what that is the higher the number, the more scary or the more anxiety provoking it is. And the lower the number, the more comfortable it is. And we talk about those feelings and why those things are really challenging. And so we're not just navigating the world. So yes, like you said, behavioral therapy is also an aspect of it because we do a lot of exposures. We do ask kids, teens, families to go to restaurants, stores, family gatherings, always be thinking about these type of interventions, exposures, and we talk about how to engage in those different environments. But we're not just throwing you in. We're talking about, well, how did that feel when Uncle Joe came up to you and asked you this question? What did it feel like after you answered the question, right? Because we know.
I mean, in other words, I remember presenting at a conference years ago, and one of the psychologists in the audience raised their hand and go, I don't really think it matters about their feelings. And I'm thinking, well, how successful are you in treating kids and teens and adults? Because what do you mean their feelings don't matter? You're disrespecting them if you don't respect their feelings. That doesn't mean we don't implement silent goals, as we call them, where we're training parents and educators of how to set the world up, how to question, when to question, with who to question, what strategy to bring out. If the child bridges down, how do you help support them to bridge them up or respect it? Like, there's so much with parent and adult facilitation. I mean, that's so much of our treatment, which is why CommuniCamp is 15 plus hours at camp while the kids are in camp. Parents are in camp. I'm in
Yeah.
camp too,
Yeah.
because they need to learn.
Yeah.
But it's such an important aspect to demystify, to acknowledge, to assess your feelings and respect that. If a child says it's a 5 out of 5, that means it's a 5 out of 5. Whatever that means to that child, that's causing them to feel uncomfortable, afraid, fearful, scared, whatever it is. Or
Mhm.
as kids get older, it's hard to do. So a 5 out of 5 for a 15-year-old, maybe it's hard to do versus scared, where a 3, 4, 5-year-old feels scared.
Yeah.
Because as we know, they age, the scaries go away and it becomes more of a conditioned response.
Yeah.
But if we disrespect them, like, I am amazed how many times I've worked with kids that come with, I would call like a lot of skepticism. Why? Because they had seen people, probably locally, who just were, let's just get them out and talk, give them money, give them tokens, take them to Disney, whatever it might be, and be really courageous to do it without understanding where they even are in the process. What are their whys? What are their baselines? And these kids have not succeeded. They failed. So their self-confidence is low. Their sense of self, obviously, low. They're not, they're more avoidant. They're more fearful. It's affecting their social, their emotional, their academic, their overall communication competence, and their ability to do things because they haven't felt successful at all. But when we start to involve them and trust them, and we believe them and we don't question them, but maybe help them understand it. Oh my God, the freedom that comes from that. That's why it's so important that they understand their bridge and they see where they are now and what it feels like with certain strategies and where they were then. It's so powerful. You start to see these kids sitting up a little taller, seemingly more positive, taking risks. And
Yeah.
then at the same time, training parents to meet them where they are, to be able to be supportive, compassionate in that kind of way, rather than just trying to get them to talk. And when they
Yeah.
are, right?
I think that when it comes to like the feelings chart too, we've had parents that will say, oh, well, like if they're never a 5 out of 5 or a 3 out of 3, which is really what we want them to work on, then does that just mean they're never going to do anything? And I, like to unpack that a lot where I say, no, that does not mean that we're not going to work on communication with our teacher, but it might mean, well, if it's, let's say it's a teenager and it's a 5 out of 5 to go up to their teacher and ask a question. No, that does not mean that we don't want to work on that goal, but it might mean what would like a 2 to a 4 range look like for them? Maybe it's emailing their teacher ahead of time, and then maybe a friend goes up with them and they tell their friend, and the friend tells the teacher, or maybe they write down the question and the teacher prompts them, and maybe just responding feels easier than initiating, so they're able to do it. Whatever it might look like for them, right? But I think that, like I always say, for an older child, like a 2 to a 4 is kind of that sweet spot, and for a younger child like a 1 to a 2, because we don't want to always feel like a 0. I mean, of course I would love to feel like that too, but we're growing when we feel a little bit of a push. But it's that happy medium, because if we're always a 5 or if we're always a 3, then we're creating this, what we call like this kind of like avoidance of anxiety, because we don't want to ever experience that. So we just start to avoid. We start to avoid. And then that's not doing anything, because now we don't want to approach any scenarios, right? So I think that's something to think about, is it's not that we never want our children to be working on things. We always want to be working on like that social muscle, but it's more, to what extent are we working? How much? And then when do we need to know to kind of take a step back? So that's one thing to kind of keep in mind. So he talked about kind of the CBT, the behavioral aspect of SCAT. I know Dr. E also touched on, the parent piece of it too. And we do have very extensive parent education, very extensive like parent management work. And we do that up until really even like our young adults. So I work with teens, young adults, and parents are still a really big part of that, because many times our kids are really reliant on us, and as we get older, there's that learned conditioned behavior. They're even more reliant. And so they're very dependent on you. We need to learn, how do we take that step back, right? What can we do to help them navigate the world on their own? And that's why a lot of older kids, independence is a really big part of the treatment plan. We try to build that into it.
A
But
big piece.
the parent piece is super important. And so we've had conversations with families where I might have a parent drop their child off in the waiting room and they're like, oh, okay, it's the intensive. Like, we'll see you in 4 hours. And I'm like, wait a minute, you're a part of this process. Like, obviously I want to do treatment with your daughter and I want to work with her. And she is obviously a big part. She's older and I want her to navigate, but I also need time with you. So when I do intensives, a lot of times I'll have a supporting clinician with me and I'm working a lot with the child, but then there is a part of this treatment where I'm guiding my supporting clinician to kind of continue doing an exposure with the child. Well, then I bring in the parents for the second half and I'm talking to them. So it's almost like 2 sessions at the same time. And so I do that because I want to talk with you. I want to kind of educate and really hear what is not working, what's working really well, how can we tweak these things, give psychoeducation about like our SM triangle, which, I know we've talked about in other episodes, but that talks a lot about how do we engage with that third person? What's that balance between, too much increased expectation, too little decreased expectation, and kind of like how do we navigate those scenarios? So anyway, the parent piece is super important. I know other approaches utilize parents as well. And the way that we really utilize you is for you to be that part of that process. We want you to help bring your child into communication. So we're not having you enable that necessarily and just talk for them, but we are having you be part of that process, because for some of our kids, it might be too much to just push them ahead and then you're kind of taking that step back. So one of the parent goals we talk about is something called frontline, where you're standing next to them, right? And they're kind of like parallel with you, ready to approach that person. That's kind of that triangle piece. So we can't minimize you guys as parents. And so, yeah, I just want to emphasize that piece, that parent management, kind of that family system approach, is super, super important.